Andrew Clennell, thank you so much for joining me. What drove this childcare announcement?
Well, I think there was a genuine fear that many childcare centres would go bust, Andrew, and then you'd have workers unable to access childcare and even more job losses than we've already seen. And you particularly didn't want to see that when it came to health workers, let's face it, because they're going to be so important in the months ahead. But all manner of, critical workers, even workers in grocery stores as we go through the tough months ahead.
Can you just clear up one point? It was a bit unclear who would get this free childcare. The Prime Minister kept saying, or did say, look, it's for essential workers, but everyone who's got a job is an essential worker. Can you clear it up?
Oh, I think it's everyone. I think it's just everyone. And you might say, well, why on earth are they doing that? But I think just like they're keeping that wage subsidy at a flat rate, even people who earn less than that $7.50 a week are going to get the $7.50 a week. The method behind the madness is you need to roll it out quickly and you need to do it simply and easily. So they're doing it that way just so it can get out there and get done. Whereas if they tinkered with means testing, etc., it would become quite complicated to administer, and they've got a lot of new things to administer at the moment.
I think they're kind of hoping that people who don't need the childcare won't use it to try to keep the places limited to children of workers, but yes, we'll see how that works. What more is coming down the pike, do you know?
Well, rent is something that needs to be sorted out. Commercial landlords are concerned that they won't be compensated when renters, but commercial renters are being told that essentially if they're in distress they won't have to pay rent. So that has to be sorted, and there's a bit of lobbying from commercial landlords to look after them a little bit because otherwise, for example, the valuations of shopping centres could go down. So that's supposed to go to National Cabinet tomorrow. The other thing we've just learned is that Tasmania, the Tasmanian Premier, Peter Dutton, is saying he and Victoria are going to press for the closure of retail. That's really interesting because New South Wales has been big on closures previously, given they've got the most cases, and they've sort of agreed with Scott Morrison's position not to close retail at this point. So that National Cabinet meeting tomorrow will be interesting. Scott Morrison's made it clear he wants to keep the economy open for as long as possible for obvious reasons, economic and social, while we attempt to flatten the curve through all the measures we put in place on the health front. So I guess that is something to be keenly watched, whether Tasmania and Victoria split off or get their way, or whether everyone keeps retail open another week, at least while we can.
Well, I just got to ask, where is the evidence that people have caught this virus shopping at a retail store? I mean, I just wonder whether sometimes the chains of causality are proved before the reaction comes in. 2/3 of the infected people came from overseas or a cruise ship. Now, I've got to ask, Andrew, I mean, I like Peter Dutton, the Home Affairs Minister, but doesn't this put the performance of his department in the spotlight? Yes.
Him and his department, look, he's a pretty good performer, Peter Dutton, I agree, but the one complicating thing in all of this is he got quite ill. He got coronavirus. So, as I understand it, he's been working in isolation and working quite hard, but it's a bit difficult when you've got that condition. But the decisions on the borders early were the entire National Security Committee of Cabinet, so they were the PM as well. And it was put to me a little while ago that the PM and others might be considering closing the borders sooner, and the Chief Medical Officer said it wasn't necessary yet, and I think they'll live to regret that. But they made the China decision in good time, and that had quite an effect on the cruise ships. Well, that's been an absolute debacle, and I think it's interesting to see federal and state authorities kind of have a bit of a blame at some of the cruise ship operators today and suggest they hadn't told the truth about the situation on their ships. But this is a crisis continuing in the sense we've got about 6 or 7 cruise ships off the coast, and if they're not Australian citizens, we don't really want to bring them in because all the hard work we're doing staying at home, etc., and social distancing could be undermined in terms of the ICU beds and hospital capacity if we get thousands of cases off these cruise ships. But it's something all nations are dealing with. We've got 1,000 Australian citizens on cruise ships around the world we're trying to bring home. But, yeah, when this is all over, somewhere over the horizon, I don't think there's any doubt we'll need some sort of Royal Commission or Commission of Inquiry into the handling of the borders and particularly the cruise ships in this whole affair.
Well, I think so, because we've got to be prepared for the next time something like this comes.
Yes.
You know, I suspect we had the world's biggest moat and we didn't use it properly. 6 months of this, said the Prime Minister today. He's quite insistent. I've obviously been arguing for a change of strategy, doing more in some areas, but releasing the pressure in others so life can be a bit more tolerable for some people. There doesn't seem to be any sign at the moment that he's preparing an earlier exit strategy.
No, unfortunately, I think that's his view, 6 months. And it could even be 12 months, Andrew. But I think over the last week or two, there have been some wins in terms of flattening that curve. The cases are still growing every day, but not at that sort of rate off the cliff. So there's hope at bringing it a bit under control. The things that could change it and bring it out earlier are a development of antiviral drugs, which a lot of people are working very hard on. That could really change things up. The PM even mentioned that today. The concern is a vaccine could take 12 to 18 months. So we've really got to hope for the antiviral drugs and that the flattening the curve strategy works. Our other hope, it seems, is that we're more like Germany, where only 1% are dying, and they've done it the same sort of situation as us. They've done a lot of testing and a lot of contact tracing to isolate people who are infected, as opposed to Italy, where there's a 15% mortality rate or 12%. So we see ourselves more as on the German tangent, but I'm afraid everyone's going to have to be very patient, and that's why the job subsidy decision this week was so important to keep our society together. It was really necessary, a lot of money, but really necessary, because probably the most concerning thing for people sitting at home, and even us, Andrew, is normally with events in the world, we can predict where something ends. You know, even we knew about recessions and depressions of 2 or 3 years, right? This is completely unprecedented, untested. And here's the other concern. There could be a situation, you shut everything down, then you start opening it up, and then there's a second wave of the virus. And that's what the government's really concerned about as well, because apparently that happened in the Spanish flu. You know, the second wave was worse than the first. So I think that's one of the reasons Scott Morrison is saying if we shut things down, we really have to do it for 6 months to make sure we're all right. I'm just praying myself. I'm not even a religious man, Andrew, but I'm praying for the antiviral drugs to work, because we'd all love to be out of this crisis.
Yeah, well, I think we've got to figure out whether one death is one death too many and we all got to be shut down where people are dying in those low numbers, or whether we should manage it a little bit more.
That's
see
true.
that our hospitals are up to snuff. But anyway, look, we shall see, and I think the pressure on will go on the government with time, because this is obviously a horrible crisis and there's no easy options. Andrew Clennell, thank you so much indeed for your fantastic reporting all through this crisis. I really appreciate you coming on.
Thanks so much, Andrew.